Hi, this is Kimberly Jones from FOTO. What I'm going to cover today are the patient-specific reports. Because as clinician, this is going to be your all's big takeaway. Every time a patient takes a survey or assessment, it's going to generate a report for you all. And the optimal time for you all as clinicians to see this report is before you see your patient. So what we have here is an intake report that was generated after the patient took their initial survey. You can see a lot about your patient even before you meet them in person. So if we look on this report, we can see our patient's name's Tess. She's a female. She's being seen for her knee. She's 75 years old. She has a preferred provider payer source. She has some comorbidities. And if we scroll down here to the second page, we can see what those are. So she's reporting to us that she has some arthritis, some back pain, depression, high blood pressure, and vascular disease. We can see also our patient's self-reported BMI. We can see their exercise history, if they're taking any prescription medication, any surgeries. And what we also offer on this report is for the evaluation reporting, we can offer the fourth component, which is the complexity level, if you choose to use it. We can look on this report right here. We could see the activities our patient was asked and how they responded. So a lot of that is pretty straightforward. Let's go over the numbers. So we look up here and we see our patient's intake score. In this case, our patient has scored a 29. Now that is based on a 0 to 100 scale. So the higher the number, the greater the function of the patient. Now you see a FOTO intake score. And what this is an average score of patients just like our patient here based on these risk-adjusted criteria. So other patients with the same care type, severity, payer, acuity, gender, age, all of these 13 risk-adjusted factors on the average, patients like our patient scored a 50. So there's no right or wrong on what your patient scores. It just lets you know where your patient is functionally compared to an average patient like themselves. Now, what we also give you on this report are the predicted values. And again, it's based on the risk-adjusted criteria. So for the orthopedic, there are 13 risk-adjusted criteria, but within those, there's 164 variables. So we are really trying to compare apples to apples here. For our predicted values for our patient here, we are predicting our patient's going to increase 26 points. So by the time they take their final status, we are predicting that they're going to score a 55. So 29 plus 26 is a 55. We're also going to give you a predicted number of visits. In this case, it's 13, and a predicted number of duration in days. In this case, it's 54. Because what we do is we give you a benchmark from the aggregate data. You're going to be asked if they want to have, how many visits do you think? How long do you think it is? Well, you can share this with them. What I also want to point out is because we give you a benchmark from the aggregate data, this is not set in stone. It is your clinical interpretation. Remember, FOTO is a tool for you all to use. So you can have your evaluation with your patient and say, yeah, I definitely think this patient can increase 26 points. But you know what? I think they can do that in 10 visits. But we're going to extend the duration out to 65 days. So again, it is a tool for you to use. And also just want to point out, if they make the predictions, but you feel they can continue increasing their functionality, that's all right. It doesn't mean you need to discharge when they've met their score. Again, it's your clinical judgment if you think they can continue to improve. What we also have on here is functional staging. So here are your different stages of function. This is the legend. And then if we look up here next to the intake score, our patient's coming in at a stage 2. So if we glance down here, we can see that that is putting our patient at a household amputation. What we also will give you is a prediction of what stage they're going to be at the end of the episode of care. A stage 3, that's going to put them at a community amputation. Because of the functional staging research, we are also able to provide minimal clinical important improvement for the patient, and for you all as clinician, minimal detectable change. You'll also see a graph over here. Our patient is the green circle, and our average patient in the FOTO database is the red square. And then our prediction of this 55, that is our prediction. So it's kind of reaching for that gold star. Now, if we come down here, we can see the questions our patient was asked and how they responded. What we can do because of the functional staging research, we can see at the end of the episode of care, we can make predictions of how our patients should do these activities. So for example, performing heavy activities around the home, we can predict at the end of the episode of care because our patient's telling them they have extreme difficulty. But we can predict our patients should have moderate difficulty doing that, again, after their treatment cycle is completed. Now, that is saying the patient is compliant. They're doing their home exercises, they're showing up for their appointments, and they are engaged in treatment. And because our item bank is large, our patient wasn't asked these functional activities, but the functional staging research can let us predict how our patient can do these. Because FOTO is a tool, a lot of clinicians will use these activities whether they were asked or not and work them in as goals, work them into the treatment plan. What I also wanted to point point out is up here in the description, up here at the top, one thing I want to point out for you all to look out for is look out for impairment and surgery type, because surgery type is part of the risk adjustment. So you want to make sure the surgery type is correct, because that can recalculate. If the surgery type needs to be adjusted, you will have training on how to do that adjustment. But basically, if the surgery type has been adjusted, patient report will recalculate. So you all will want to take a look at the predictions again after it's recalculated, because some surgeries are more invasive than others. So it could increase the number of visits, increase or decrease, and it can increase or decrease the duration of the visits. That is for the intake.